Welcome to the Healthcast by Reem Hospital, where we break down complex medical topics into clear, relatable conversations. Today, we're talking about something that can often bring up feelings of fear or uncertainty: dementia.
Yeah, it's one of those words that instantly makes people anxious, but understanding what dementia actually is, what causes it, how it progresses, and how it can be managed really helps take away some of that fear.
Exactly. And while dementia is challenging, it's not a hopeless diagnosis. With the right understanding and care, people living with dementia and their families can still have meaningful, connected lives.
So let's start with the basics. Dementia isn't one single disease. It's actually a group of symptoms that affect how the brain works. Things like memory, thinking, reasoning, language, and even behavior.
Right? It's more like a syndrome, isn't it?
Exactly. People with dementia might have trouble remembering recent conversations, following directions, or completing familiar tasks. They may also experience mood swings, confusion, or personality changes. Over time, these changes can make it harder to stay independent.
So, what actually causes dementia? What's happening in the brain?
Dementia happens when brain cells are damaged, either by disease, injury, or abnormal protein buildup, which disrupts how brain cells communicate. The most common cause is Alzheimer's disease, where protein deposits, known as amyloid plaques and tangles, build up and interfere with brain function.
And then there's vascular dementia, right?
Yes, that's when the brain's blood supply is affected, often after strokes or other vascular damage. There are also other forms like Lewy body dementia, which causes movement and behavioral changes, and frontotemporal dementia, which affects the parts of the brain responsible for personality and language. That one can appear earlier in life, sometimes due to genetics.
So, it's not one size fits all, and the symptoms and causes really depend on the type.
Exactly.
Speaking of symptoms, what are some of the early signs people should watch for?
The most common one is memory loss, especially trouble remembering recent events or conversations. But dementia isn't just about memory. You might also see changes in language, trouble finding words or following a conversation, or problems with judgment and decision making. People can get disoriented, forget where they are, or have sudden shifts in mood or behavior.
So, if someone's becoming more withdrawn, forgetful, or acting differently, it's worth checking in, not just writing it off as getting older.
Exactly. And that's such an important point. Not all memory loss means dementia. Some forgetfulness is just normal aging, but when it starts affecting daily life, that's when doctors need to take a closer look.
And people sometimes confuse dementia with amnesia, right?
Yes, but they're very different. Amnesia is mainly about memory loss, often caused by injury or trauma. Dementia affects multiple brain functions, not just memory, but also reasoning, communication, and daily functioning. Amnesia can sometimes improve with recovery or therapy, but dementia is usually progressive, meaning it gradually worsens over time.
Let's talk about that progression. What are the typical stages?
In the early stage, the signs can be really subtle, maybe misplacing items, forgetting appointments, or repeating stories. In the middle stage, things become more noticeable. Confusion grows, speech and reasoning decline, and daily tasks become harder. By the late stage, people usually need full-time support with care as memory, movement, and communication become severely affected.
That's tough, especially for families watching those changes.
It is, but understanding what's happening and planning ahead can make the journey less overwhelming.
You mentioned Alzheimer's earlier. People often use dementia and Alzheimer's interchangeably, but they're not the same, right?
That's right. Alzheimer's is actually the most common cause of dementia, but it's just one type. Think of dementia as the umbrella term, and Alzheimer's as one of the conditions underneath it. The difference is that Alzheimer's has a very specific cause, those protein tangles and plaques that slowly damage brain cells.
So while all Alzheimer's is dementia, not all dementia is Alzheimer's.
Exactly. Well put.
Now, when it comes to treatment, can dementia be cured?
At this point, there's no cure for most types, but there are treatments that can slow progression and improve quality of life. There are medications that help manage symptoms, especially in Alzheimer's. Therapies like reminiscence therapy where patients talk about meaningful memories, can help with mood and engagement. And then, of course, supportive care, things like routine, structure, and emotional reassurance make a huge difference.
And I've heard there's some promising research happening right now.
Yes, and it's exciting. New drugs are being developed to actually target those abnormal proteins in the brain. There's also work being done on neuroprotective and regenerative treatments like stem cell research and therapies that protect or repair brain tissue. It's still early days, but the direction is hopeful.
That's good to hear. And even though there's no full prevention, there are ways to reduce risk, right?
Absolutely. Keeping your brain and body healthy really matters. Things like staying mentally active, reading, learning new skills, doing puzzles can help build cognitive reserve. Regular exercise improves blood flow to the brain, and a balanced diet, like the Mediterranean or MIND diet, supports brain health.
Hmm.
Managing blood pressure, staying socially connected, treating hearing loss, and getting good sleep also helps.
So lifestyle plays a bigger role than people realize?
It really does.
Let's talk about caregiving, because dementia doesn't just affect one person, it affects the whole family.
That's true. Caring for someone with dementia can be rewarding, but also exhausting. Creating a safe and structured environment at home helps. Things like removing tripping hazards, labeling rooms, and keeping routines consistent. Encouraging small daily activities, folding laundry, setting the table, or listening to music can give a sense of purpose and connection.
And patience is key, right?
Always. Communication can be tough, so short, calm sentences, and lots of reassurance go a long way. It's important to focus on how you respond, not just what you say. Avoid arguing or correcting harshly. Instead, gently redirect or reassure.
That sounds like such simple advice, but it makes all the difference.
It really does. And caregivers need care too. Taking breaks, seeking respite, or joining support groups helps prevent burnout. You can't pour from an empty cup.
That's a good reminder. So, to sum it up, dementia is more than just memory loss. It's a journey that affects the mind, emotions, and relationships. But understanding it and having the right support makes all the difference.
Exactly. There's no cure yet, but there is care, connection, and hope. And with early diagnosis, medical management, and compassion, people with dementia can still lead meaningful lives.
If you or someone you love is showing signs of dementia, don't wait. Talk to a neurologist or geriatric specialist at Reem Hospital.
Getting assessed early helps you plan, treat, and prepare with confidence.
Thank you for joining us for this episode of the Healthcast by Reem Hospital. If this helped you understand dementia a little better, please follow and share. It might help someone else too.
Take care of yourselves and each other. We'll see you next time.